Welcome to Truth and Wellness, where we're committed to uncovering the real strategies behind lasting health transformations. I'm your host, Pavel Gray, and today I'm thrilled to introduce our guest, Dr. Kent, a doctor of pharmacy and glutathione expert who's devoted his career to health optimization.
Today we are talking about a blood marker that predicts disease risk better than cholesterol, blood pressure, or blood sugar. But almost no doctors test for it. My guest is Dr. Kent, a wonderful expert in this field. He's going to explain why this matters. Dr. Kent, what is this mystery marker?
Glutathione, specifically intracellular glutathione levels. Research shows glutathione status predicts mortality, disease risk, and overall health better than most standard blood tests. Yet it is almost never measured in routine medical care.
Why do doctors not test for it? Seems like a crucial thing to monitor.
Two reasons. First, there is no standardized clinical test that most labs can run. Glutathione is difficult to measure accurately because it exists inside cells, not in blood plasma. Blood tests measure what is floating in your bloodstream. Glutathione works inside cells. Second, even if we could easily test it, there is no drug to prescribe. Doctors are trained to diagnose problems they can treat with prescriptions. Glutathione optimization requires nutritional intervention. That is not part of standard medical training.
So people could have dangerously low glutathione and never know it? That seems frustrating.
Yes. And the symptoms are often dismissed as normal aging. Fatigue, brain fog, slow recovery, frequent infections, chronic inflammation. It's all so non-specific. Doctors run standard tests. Everything looks acceptable. So they tell you nothing is wrong. Yet your cells are screaming for glutathione. The standard tests do not detect that.
What does the research show about glutathione and disease risk? I'm curious.
Studies published in medical journals show that low glutathione correlates with increased risk for cardiovascular disease, cancer, neurodegenerative diseases, diabetes, and even premature death. One study, for instance, followed elderly subjects for years. Those with higher glutathione levels lived longer and stayed healthier. But those with depleted glutathione developed chronic diseases and died earlier. The correlation was stronger than many markers doctors test routinely.
That is shocking. How can something so important be ignored by mainstream medicine? It feels like we're missing the boat here.
Because the medical system is built around pharmaceutical interventions, nutrition and functional medicine aren't quite as valued. Nutritional biochemistry generates no profit for drug companies. Medical schools receive funding from pharmaceutical companies. Doctors learn to diagnose and prescribe. They don't learn how to optimize cellular function through nutrition. This isn't exactly a conspiracy. It's just how the system evolved. But it does leave a massive gap in patient care.
So if someone wants to check their glutathione, what should they do? I can imagine many listeners are eager to know.
Functional medicine doctors and integrative practitioners sometimes order specialized tests for oxidative stress markers and glutathione status. But these tests can be quite expensive and typically not covered by insurance. Alternatively, you can assess glutathione status indirectly through symptoms, chronic fatigue, frequent illness, slow recovery, chemical sensitivities, and inflammatory conditions all suggest depleted glutathione. A therapeutic trial of bonded cysteine for 90 days often provides more useful information than any lab test.
What would a therapeutic trial look like? It sounds intriguing.
You start by establishing a baseline. Track energy levels, mental clarity, recovery time, immune function, and any chronic symptoms. Then you supplement with 2 sachets of Immunocal daily for 90 days. Throughout that period, track the same metrics. Most people tend to see measurable improvements across all areas. That tells you your glutathione was depleted and that restoration is working. If you see no improvements, either your glutathione was not the limiting factor or 90 days was not enough time to restore severely depleted reserves.
This seems like something everyone over 40 should do. It sounds critical.
I absolutely agree. Research from aging specialists like Dr. Wolf Droge suggests aging itself might be primarily a cysteine deficiency syndrome. After 40, glutathione production declines by 50%. That decline drives most age-related health problems. Restoring glutathione through bonded cysteine supplementation reverses many of those problems. This research is published in prestigious journals, like the Philosophical Transactions of the Royal Society. This is not fringe science. This is cutting-edge aging research. I will include a link for a 5-day sample kit of the original immunocal and booster for people that want to get a feel for the taste and practice mixing the product before they commit to a monthly supply in the description section of this podcast.
If this is so well researched, why are more doctors not talking about it? It just seems so necessary.
Change happens slowly in medicine. It took decades for doctors to accept that vitamin D deficiency causes problems. Now, vitamin D testing is pretty much routine. The same will eventually happen with glutathione. But we are still early in this conversation. Patients need to advocate for themselves. They need to educate themselves. They cannot wait for the medical system to catch up.
What should people ask their doctors? I think this could really help many listeners.
Ask about oxidative stress and antioxidant status. Ask if glutathione depletion could explain your symptoms. Ask about nutritional strategies to support cellular health. Many doctors will not have solid answers, but asking the questions starts a conversation. It also signals that patients care about prevention and optimization, not just symptom management.
And if their doctor dismisses these concerns, what should they do?
Find a functional medicine or integrative medicine practitioner. These doctors are trained in nutritional biochemistry. They understand that cellular health determines overall health. They can guide you through glutathione optimization and monitor your progress properly. You deserve a doctor who sees you as a whole system, not just a collection of lab values.
This conversation is empowering. It strengthens the narrative. People do not have to accept decline as inevitable. They can take action even if their doctors are not educated about it.
Exactly. Your health is your responsibility. Doctors are consultants, but you are the CEO of your body. Glutathione optimization is one of the most powerful tools you have for disease prevention and healthy aging. The research is clear. The results are reproducible. The safety profile is excellent. You do not need permission to optimize your cellular health.
Dr. Kent, thank you. This was quite eye-opening and informative.
Thank you, Pavel. I truly hope your listeners realize how much control they have over their health trajectories. Glutathione is the leverage point most people are missing.
Thanks for tuning in to the Truth in Wellness podcast, where your journey to mastering wellness begins.